For a medical moment today, I wanted to talk about a patient that was here last week. This was a 9-year-old male neutered black lab mix who was totally fine first thing in the morning when he got out of bed. By the middle of the day, he was weak and tired and collapsing. We had the owners rush him in, and on physical exam, he was in shock. His gums were pale, his refill time was long, and he was cold. His extremities were cold. So initially, we treated him for shock, which is to say we give IV fluids, we give cortisone, and he did not improve. We did routine blood work, which was completely normal. His kidney and his liver, his blood sugar, his electrolytes. We measured his cortisol level to see if he might have Addison's disease. It was elevated, as it should be for a pet who is in distress. So we couldn't find the reason for his shock. We took chest x-rays and his lungs were clear and the shape of his heart was normal. It was not enlarged. But as we're treating him, he's not getting better. So then we did a cardiac ultrasound to see the motion of his heart, and what we found was that the heart, as you may know, it's a pump. It's a top and a bottom, atrium and a ventricle, and the entire thing is surrounded by a sac. It's called the pericardial sac. This dog had fluid accumulating between his heart and the pericardial sac. And the sac can't stretch very quickly. And the fluid, as it turned out, was blood. And because there was blood inside the sac but outside the heart, that fluid was squishing the heart and making it small. So even though the heart was beating, it wasn't moving enough blood, and that's why the dog was having symptoms of shock. And with our cardiac ultrasound, we were able to see that the cause for the blood in the sac around the heart was a tumor. He had a tumor on his heart that was bleeding into the pericardial sac, and that's why his heart was being squished. So unfortunately, in that situation, his prognosis is very poor. The right now therapy to save his life is to remove the fluid from around the heart, but unless you can solve the problem, then it's very likely the fluid's going to come right back. And doing open heart surgery to remove tumors off the heart is rarely done, and when it's attempted, it's rarely successful. And unfortunately, as you guys know, this pooch passed away. But the reason I mention it is because it's an example of course, there's lots of other reasons why dogs would be in shock, and having a tumor on the base of your heart is not at all common, right? It would be common for a dog to be in shock because it was stung by a bee, or it got into a poison, or a toxin, or it had some sort of a trauma, it fell off the stairs or got hit by a car, right? Those would all be very common causes for shock. If he'd been sick for a while, then dehydration, vomiting, diarrhea, but this dog went from normal to distressed very quickly. And the reason is because the tumor, though the tumor had been there, it bled very quickly. Not that he was losing so much blood that was the problem. It was the problem that the blood that did accumulate was compressing his heart. So it's a good example of where, as doctors, when the pet walks through the door, we don't know exactly what the problem is. We try to gather information from the client. Did your pet get hit by a car? Is there a tire mark running over their body? Right, that's useful information. And an example of a sudden cause of shock, right? Physical exam led us to the kind of problem the pet was having, but it didn't tell us the reason until we did a diagnostic test. And we always start with common tests because they find common problems. But in this case, we had to continue to test until we found the problem. We do not routinely do echocardiograms on dogs in shock. But since everything else was normal, that's what led us to that tool, and that's how we got the answer that we needed. So anyway, that's the scoop.